the fourth chapter in this unit. It is on reproductive health. Reproductive health. So in this chapter we are going to discuss about some of the problems associated with reproduction in humans and the solutions for such problems. So it is basically about problems associated with human reproduction and related solutions. We come across three different kinds of problems related with reproduction in human beings. One is infertility. Infertility, inability to conceive, infertility. The other one is birth control, measures taken to reduce the birth rate, birth control. And the third one is sexually transmitted diseases. Sexually transmitted diseases. So let's take one by one. Let us begin with the problem of infertility. Infertility can be defined as inability to conceive. Inability of the couple to have a child. Inability to conceive. The process of successful reproduction leading to pregnancy, it's generally described as conception. If conception has to take place, there are four important conditions. One is that the reproductive organs must be functionally and anatomically well developed. Functionally and anatomically well developed. So both in the male and the female, the reproductive system should have reached the normal development if conception has to take place. The second important condition that is required is particularly in the female. The reproductive cycle, or what we have described as the menstrual cycle, must be regular. Menstrual cycles must be regular. All the associated hormones, everything must be normal. And another important condition that is required is that in the male, the sperm quality when you talk about sperm quality, it may be the volume of the semen, it may be the activity of the sperms. We will come back to that later. Sperm quality must be satisfactory in all parameters. In all parameters. Another important condition that is required is mating of the male and the female, or what we describe as intercourse or copulation, must occur around the time of ovulation. Around the time of ovulation. So if these four conditions are satisfied, then conception can happen. If there is a problem with any one of these, then conception cannot happen, and this leads to infertility. There are two types of infertility. Two types of infertility. One is primary infertility. Primary infertility. In primary infertility, it is total inability to conceive. Total inability to conceive. Whereas the second type is called secondary infertility. Secondary infertility, where infertility may set in after the birth of the first child. After the birth of the first child. The first child may be born normally, but for the second, infertility may set in.